Hello everyone, and welcome to another edition of Eyecare Today. I'm your host, Dr. Thomas Kislan, and for those of you watching in our Stroudsburg area, remember if there's any questions or comments, please feel free to contact our office in Stroudsburg, 421-3342. Those of you watching in the Hazleton area, our office in Hazleton, 453-2020, and as always, catch us on the web at www.drkislan.com. Now, the last show I did with Dr. Frank Bucci, we got so many great comments and questions about everything going on with cataract surgery nowadays and all the new technology that I just had to bring him back on. So Dr. Bucci, thanks for joining us again tonight, taking the time to educate everyone out there about all the exciting stuff that's going on in eye surgery nowadays. And you know what's great about this is we're coming to you right from Dr. Bucci's operating room in Wilkes-Barre. It's so great to have a facility right in your office where you can offer patients in the area cataract surgery. So this is a beautiful, beautiful facility. So thanks for
my
coming.
pleasure to be here.
You know, let's just review a little bit for the folks at home. Cataract surgery is probably the most common surgery done in the U.S. now. And let's just quickly review what a cataract is, just for the folks out there who maybe didn't see our last show. I'm sure there's not many that didn't see it, but for those that didn't, what is a cataract?
Well, I'll explain it just the way I explain to my patients in the exam room, and it's a very practical way of looking at it. If we look at the eyes, a cross section of the eye, I always tell my patients the eye is as big as a grape. And in the front of the grape, there's a mini M&M. And actually, the lens of the eye is the exact shape and size of a mini M&M, and we've all seen that. And when we do cataract surgery, we go in through where the clear meets the white of the eye with a micro incision, like less than 1/8 of an inch, 2 thicknesses of a dime wide. We take the coating off the front of the M&M, break up the chocolate with sound waves or light waves, extract that, and then you have an empty pouch here. And then we put a 6mm lens through a 2mm wound right here because it's rolled up like a taco. And then it form-fits in the pouch shrink wraps on it, and the lens is right where God had the focusing in the first place. And I do that in 4 to 6 minutes, and I've done it 26,000 times. So I'm finally getting good at it. So that's what cataract surgery is. And then, then we talked about there's different kinds of lenses we can put in the pouch.
Well, before we get into the lenses, is there any pain in this?
No pain whatsoever.
So how does that happen? So if you're going to do surgery on my eyes, which you did 16 years ago, you did LASIK on me.
Right.
How do you make it so that there's no pain?
Okay, so for cataract surgery, when we go inside the eye, the eye is numbed with no needles, no stitches, no patches.
Just with eye drops.
Just with eye drops, eye gel, eye drops numbs it, and then we give the patient some extra sedation. Which just takes I always tell them if you had no sedation, your eyes still wouldn't have any pain anyway, but it allows them to relax.
Okay. So, all right, so now it's no needle, no stitch, no patch, no pain.
Right.
And now we've got these implants that go in that allow the patient to see.
Right.
They have come a long way, and I know we spent the whole last show on that, but let's just review what we can do now for patients as far as these implants.
Okay, so quickly, there's distance-only lenses. Now, you can get the insurance generic lens, which about 40% of my patients do, but about 60 upgrade to what we call premium lenses that do above and beyond. One example, patients that have had astigmatism in their glasses, now the astigmatism correction can be in the implant itself, and thus it's in the inside the eye. So when the patient heals up the day after surgery, now they don't need that correction in front of their eye. So that moves towards freeing them from glasses. We also have a multifocal lens, which allows them to see distance, intermediate, and up close. So in that way, two of those lenses, 98% of patients, 99%, no glasses for the rest of their life. And then there's something called distance deluxe lenses, where it's distance only. No halos at night whatsoever. You'd still need reading glasses from here in, but looking out in the distance, it's like high definition. It's like the whole old example of the old TV versus your high def TV. You look and you see that extra clarity, and you get that very high tech clarity.
So all this technology has just led to better improvements in how these patients are going to see post-operatively.
Better quality vision and more freedom from the glasses, contacts, bifocals, reading glasses.
Okay, and all in 6 to 7 minutes, no pain. And then how long after when one, first of all, both eyes the same day or no?
No. So anything on the outside of the eye, like LASIK, when you're operating on the cornea and you don't ever penetrate inside the eye, and because LASIK gives you very rapid rehabilitation of vision, you can do both eyes. But whenever you go inside the eye, by convention and actually law in the United States, you have to wait at least a week or so before you would go inside the other eye.
Okay.
So not the same day for intraocular surgery.
So at least a week afterwards, then get the other eye done.
Right.
And then patients are great, both eyes.
Yeah, my patients have full activity in one day. Most surgeons, it's 1 week, no bending and lifting. I use a 3-stepped wound, and it kind of has like a self-sealing valve. It's only 1/8 of an inch wide, and it self-seals in a day. And I say, why should a patient limit themselves when I know we've tested the eye is equally strong the day after, you know, than before the surgery, so they're ready to go.
And that's great. Patients want to get back to their daily activities. So now, things have changed so much also with a disease called glaucoma.
Right.
And most of our patients, unfortunately, as we get older, we get cataracts, and also as we get older, we get glaucoma. So, you know, we both see a lot of these patients that have both diseases together. So review for the folks at home what glaucoma is.
Okay, in a real practical way, kind of like our M&M scenario, real practical way, the eye is a globe, a closed globe. Inside it has cells that produce fluid, like a faucet, and the fluid comes around through the pupil from back to front and then exits in this angle right here, and that's the drain. And this is actually a magnification of that drain, and it actually looks like a drain with all those webbings there. So glaucoma, for the most part, is a defect in the drain. So you have more fluid coming in than's going out, and then what happens? The balloon, the bubble, the ball would expand. And as it expands, it starts to press on. That pressure presses on, the pressure goes up and presses on the optic nerve fibers, the optic nerve right here, and it begins to slowly kill them off, and then you lose vision from periphery. And you can lose half your vision and not notice it, because it starts out in the periphery and you looking straight ahead and you think everything is great. And that, just to say one important thing, that's why you get an eye exam every year, because that can be happening, and as the pressure can go from 15 to 25, 25 can make you blind, but you won't feel a thing. I had an uncle that saw through a straw, and he says, I'm 20/20, but everything was gone except, you know, one or 2 degrees of his vision.
And that optic nerve, I mean, if you can just reference up to the top there, that optic nerve goes all the way back to the brain.
Right.
And that's where all the vision takes place, is the brain. So, you know, when there's damage to that optic nerve, like you said, we're not going to be able to see. So, you know, so for the folks at home, glaucoma, cataract surgery together, there's now some new technology. Well, while you're doing that great cataract surgery, we can also fix the glaucoma.
Right. And this
go
ahead.
We need to take a break.
Okay.
So we're going to let everyone hang there.
And they'll come back after the commercial.
They will come back to see this, because you are the only one in the area that is doing this. This is fantastic technology, folks. So when we come right back from this break, you're going to hear all about this new technology to treat glaucoma during cataract surgery. So we'll see you in a couple seconds. Welcome back, everyone, and thanks for joining us on Eyecare today. I'm your host, Dr. Thomas Kislan, and again, I'm joined today by Dr. Frank Bucci, coming to you from his surgery center right here in Wilkes-Barre. Remember, if there's any questions, please feel free to call our office, Hazleton 453-2020, our Stroudsburg office 4213-3342, and you can also call Dr. Bucci's office 877-733-2015. So again, Dr. Bucci, thanks for joining us. Before the break, we were talking about patients who have not only cataracts, but have a condition called glaucoma. Now they go in for cataract surgery, and there's some new technology now that allows these patients to get their glaucoma helped right during cataract surgery. And you are the only surgeon in this area, all the way out to New York, New Jersey, doing this surgery. Right. So I think that's something great to be proud of. But let's educate the folks out there and tell them what this technology is.
Yeah, it's a major breakthrough, and I'm really excited about doing it, and we've been doing it a lot in the last month or so. So the technology is called an IStent. It has a long name, but the basic name is an IStent, and that looks like a rather large device. The device is the smallest device ever approved by the FDA. And if we look here, there's a penny, and my pointer covers it completely. So it's a tiny, tiny thing.
But what is a stent?
A stent is something that allows fluid to pass from one area to another. Like we all hear about heart stents. When your coronary arteries get clogged, they put a stent, which means allows the blood to pass from one to the other. And if we look here back, I referenced the drain of the eye. Here's the blood vessels that actually take the eye fluid away from the eye. That's the completion of the drain. So we noted that the defect is here. So what the stent does, it actually it facilitates the blood going from inside the eye, bypassing the disease area and getting to the blood vessel here, which is actually a vein that takes the fluid away.
So the way this works, basically, a patient comes in, they're on glaucoma drops
Right.
before cataract surgery. The purpose of this is to improve their glaucoma, so either we reduce their dependency on the drops. If they're on more than one drop, maybe we get them off a couple of their drops and maybe only need one. That's kind of the goal.
Right.
Is that correct?
The goal is to either reduce your pressure, reduce your medication, or both in some cases, or both. Yes.
Okay. So how long has the iStent been FDA approved?
I think it was approved last year at some point, and then has moved along. It's gaining popularity, and I've been watching it and studying it and making sure the results are good. And now that the really very sound reports coming out, one report showed the average number of medications was about 2.6 in a group of 100 patients, and it went down to 0.9. So kind of 2.5 meds to 1 med. And the average lowering in pressure was about 3.5 points per patient. And so that's very impressive, and it's such a low risk procedure that it's not overwhelmingly successful in every patient, but a very, very high percentage. So you have everything to gain and really not much to lose.
So if a cataract surgery takes 6 or 7 minutes, and now you're going to do the iStent, how much longer does that add on to surgical time?
Right. Well, the good thing is I'm down to about 4 to 6 minutes on average, and it adds about maybe 1 to 2 minutes.
That's amazing.
Yeah, and you'll see there's a little visualization involved, and then delicately placing the stent in the proper place, and we're going to show you some videos of that so you can appreciate it. And so it's a very fine microscopic procedure, and you're actually going to see the little snorkel, the little port where you can imagine the fluid in the eye actually exiting, and it's actually sticking out right there. And actually right here is a picture of it. That's the snorkel. Once the part of this part is actually hidden by the meshwork, and all you see is the snorkel coming out. So it goes right through there, and then would bypass from here out to the venous system of the eye and lower the pressure.
So a patient can have their cataracts fixed, their glaucoma fixed in less time than usually when they go get their teeth cleaned.
That's right.
I mean, that's pretty amazing stuff.
And previous to this, there were some surgeries. There are glaucoma surgeries for people when their pressure is out of control, but they're very invasive, very deep scleral wounds here, stitches, and an hour extra on top of the cataract surgery. And
more intense anesthesia.
And very high complication rate.
Right.
So the fact that we can now avoid that and bring you toward better control, it brings you farther away from ever needing that kind of surgery. So it's very, very effective in improving the quality of life, and we're now more than ever appreciating. We always talk about dry eye. A lifetime of glaucoma drops with those preservatives isn't
really
good for the ocular surface.
Right.
So reducing those drops is just good for other parts, other diseases that can occur in the eye also.
So not only the importance of eliminating possibly the effects of dry eye, but the cost patients have of taking 2-3 medications. We cut them down from 3 medications to 1. I mean, that's just an amazing thing for patients. So the other question would be, is this covered by Medicare? Or is this an out-of-pocket expense?
Yeah, so no, this is an insurance covered procedure. It's covered by Medicare. So your typical cataract patient, they're coming up for cataracts, and they happen to be on glaucoma drops, and they've been fighting to control their glaucoma, and they can have this add-on procedure. Not a lot of time, not a lot very invasive, not a lot of complications, and have better glaucoma control when they're done, and it's covered by insurance. Excellent.
That's amazing. So 3 videos now we're going to actually show the patients. The first one's an animated video that we're going to walk the folks at home through to show them exactly what it is.
Right.
And then the next two are actual surgical videos, and I know the one you just did today.
Just did today.
You just finished today.
So it's not highly edited, it's the real deal.
Right,
so.
right.
And you have to watch closely. The animation will help you because it'll guide you as to what you're trying to see in the videos.
Okay, so let's start that video.
Okay, great.
Okay, so this first video, Dr. Bucci, walk us through what we're seeing here.
Well, you see the stent, and now it's a great way to see, appreciate how small it is. You know, it's placed on top of a penny. Again, the smallest device ever approved. Now this is a special mirror that goes on top of the eye, which allows you to see what we call the angle of the eye, where the cornea meets the iris. And this is just showing in an animated way that little stent going into that meshwork, that drainage part of the eye, and it's going to allow the fluid to bypass, and that the little blood that comes back lets you know that you have connected to that external area that you want to. When you want that little blood to come back, and you're actually going to see that in the videos, because that lets you know that the stent is in the right place.
Right. Okay, so now
you can actually see the stent, and you see the implant from the completion of the cataract surgery. We're going over the top of the implant, and you can see a nice glistening little iStent right there. And now I'm going to be putting on that special mirror, and there's a lubrication between the mirror and the top of the eye here, the cornea. And you know, we're lining it up so there's a little bit more of the material that allows us to visualize that special angle. As you saw in the animation, see, as always, it's a little bit more complex than a real eye. And you're just going to go in very quick. It's going to pop in right there, pop in, and then we release, and you can see what we call the snorkel, the little round area where the fluid.
Tiny little
There's
bit of blood.
Tiny little blood, so we know it's in the perfect position, and it's that quick.
So I think, you know, what we need to, you know, let patients know as we wrap this up is that, you know, the technology has just changed so much that we can just change their lives with these surgeries more than ever before. And we're going to go to another break now, and when we come back, we're going to talk about how you really did change someone's life. Right. So we'll talk in the next segment.
Great.
Welcome back, everyone. Again, you're watching Eyecare today, and on our last segment, some amazing technology, Dr. Bucci. You talked about how, you know, cataract surgery, glaucoma surgery can change someone's life, and every once in a while you get one of those patients that walks in the door and you really do change their life dramatically. And I think, you know, you were very fortunate to be able to do surgery on a local personality in the area, Drew Spire, who's the news anchor for the local WBRE NBC affiliate, and had some pretty intense eye problems. And we have a 6-minute video here we're going to show the folks that he did, really showing his journey through improving his vision. It's an amazing video, so let's share that with the folks right now.
Great.
When this family photo was taken, I was 2 years old. Before my 3rd birthday, I was wearing glasses permanently, through grade school, playing high school sports, and beyond. Glasses or contact lenses had always been an important part of my life.
Look at my ear over here.
Then, things changed during a January visit to Dr. Frank Bucci of Bucci Laser Vision Institute.
You're so farsighted now, without your contact, without the farsightedness being corrected, you're very, very blurry. And then the amblyopia makes you even more blurry.
Amblyopia is another word for lazy eye. I had known for years my vision could not be corrected through LASIK surgery. I was just too farsighted. But Dr. Bucci said my sight could be greatly improved without having to wear glasses or contacts again, ever.
We are world leaders in multifocal lenses and putting lenses in people's eyes to get them out of glasses for the rest of their life.
In my case, it meant cataract surgery, where the cataracts are removed and an intraocular lens called an IOL is placed in the eye.
And we have implants that we call multifocal implants that allow you to see in distance, intermediate, and up close. And 99% of those patients, after implanting 2 of those multifocal lenses, will be out of glasses the rest of their life.
Dr. Bucci is an internationally recognized expert in refractive and cataract surgery. He's the top multifocal surgeon in Pennsylvania and among the top 10 in the country.
We're always looking to improve the surgical technique.
He's performed over 26,000 microsurgical eye procedures, has published almost 90 articles, and given over 150 major addresses at key ophthalmology meetings throughout the world.
So, that's a way to build a career and be devoted to excellence in surgery.
Since seeing is believing, I chose to have the surgery. We began with my amblyopic or lazy left eye.
So working on your so-called bad eye, we can make it a pretty useful eye. We can get it in the ball game, where one, you don't have to wear contact anymore.
It was time for surgery. This is the nice part.
We're not going to torture you.
I was prepped, point of no return now, and then waited for my turn to go into the operating room.
Okay. You're next to go in. Okay.
Once in the OR, some final prep work is done.
Sure, my name is Denise. I'm Dr. Bucci's scrubner. So I'm going to start with a drape over your left eye and get you ready for Dr. Bucci. Okay?
During cataract surgery, my pupil is dilated. It gives Dr. Bucci extra space to work with.
It happens that the cataract is shaped exactly like a mini M&M. So, we want to take the coating off the one surface and then scoop out the chocolate, so to speak, and then the implant gets put in that empty space.
The entire surgical process took just a few minutes. Before I knew it, it was over.
You're all done. So his farsightedness is gone. And so we use the distance deluxe lens and aspheric lens that's going to help him get high quality, premium distance vision.
Dr. Lee did a good job. See you tomorrow.
Still medicated in recovery, I could already see positive results. It brings everything closer and sharper, like my contact lens did. But I think once all that stuff wears off, I'll be able to see it even clearer. 3 weeks later, I was back for surgery for my right eye.
I'm even more nervous now because this is my good eye. This is the only good eye I've got, the one that I do all my seeing with.
The surgery was quick, effective, and successful.
Everything was nice. The nice soft eye, hard cataract came out fine. The soft cataract came out fine. Implant went in great. You're closed, no stitches at all. It was 4.5, 5 minutes.
The next day I was back for a checkup.
I see an H, a V on the right, maybe a D next to the V.
And for the first time ever, I had 20/20 vision in my right eye, without glasses or contacts, and I could see clearer, sharper, and better than ever before.
All your weight on your chin. Perfect.
But I wasn't finished. About a month later, there would be one more procedure.
Blink twice. Open nice and wide.
I needed AK surgery in both eyes. AK stands for astigmatic keratotomy.
The cataract is done inside the eye, but the structure of the cornea over the front of the eye can retain some astigmatism.
The AK surgery corrects that.
This is the final stage of being able to see clearer, sharper, better forever.
After some prepping in the examining room and operating room, I was ready to go.
They're going to cut my cornea apparently to reshape my eye so it fixes my astigmatism.
A few minutes later, Dr. Bucci went to work.
Okay, look at the two light streams.
Incisions are made outside of the optical center of the cornea, causing it to relax and become more spherical or round like a basketball. A spherical cornea allows light rays to focus at one point on the retina, resulting in a clearer image.
It means the blurriness goes away. The rounder your cornea, the clearer you see. More like a football, the blurrier you see.
When Dr. Bucci was finished, my journey to improved eyesight was all but complete, and it was clear seeing is believing.
It's just amazing technology. It's absolutely amazing.
We do what we do, and we think we're very, very good at what we do. And if we get good results, the patients talking to the community is how we're successful.
Good luck.
No, we're not.
Take them all.
They're teasing. They're teasing.
I just don't want you by this.
So that's an amazing and intense video, and that must make you feel great to be able to do something like.
And
like
Drew
that.
did such a great job of really communicating what his experience was. So, and what's very interesting, of the lenses we talked about before that can be put into this capsular bag, he had the Distance Deluxe lens. Because of his bad eye that he made reference to, he couldn't have a multifocal lens. But he was thrilled to get excellent distance vision really good in his good eye, but he went from 2400 to 2040 in his bad eye. The eyes can work together now, and so he did have that distance deluxe lens. Which
He's a young guy.
Very young guy, yes.
Yeah. So you changed his life.
Makes me happy. That's what I'm
Yeah.
here for.
Yeah. God worked through your hands.
Yeah. My pleasure.
So thanks for sharing all that great information. We covered a lot of material. I'm sure we're going to get some questions and comments on that, so we'll maybe do another show on this again. And as the iStent moves along, we'll talk more about it. So everyone, thanks for joining us on Eyecare today. Again, I'm your host, Dr. Thomas Kislan. I was joined today by Dr. Frank Bucci, and we'll see you next time.